Yes, good evening, everyone. As Paula has said, I am a current clinical psychology student, a third year, and today I will be talking about health psychology. I will give you an overview of what health psychology is and be sharing with you some of my experiences in terms of the training that I have recently received in the field of health psychology. Before diving in, I want to give an overview of what is health. So the Merriam-Webster Collegiate Dictionary describes health as freedom from disease, pain, or defect. While this is a clear definition, it doesn't take into account other factors that impact health, other factors such as environmental factors, physical factors, or mental factors. The World Health Organization, they considered what are some other factors that impact our health. And they came up with the definition of a state of complete physical, mental, and social well-being, and not just merely the absence of disease infirmity. Because if we look at it from that point of view, then we're able to understand that health is impacted by different factors. This particular definition that we have here is foundational to health psychology because instead of, as I said before, describing as an absence of disease, it's describing health as a balance of physical, mental, and social well-being. And one other thing that I want to point out about health is that health is ongoing. It's not something that, we can achieve or complete. Health is something that we make decisions about every single day based on the behaviors that we engage in, based on the thoughts that we have. We all impact our health. And one of the definitions that is common in the medical field among physicians is the biomedical model. So these are two models. The first is a biomedical model. And the biomedical model, it says illness is an impairment of the body caused by microorganisms that lead to illness or disability. So what this is saying that if you have an infection or some type of internal illness, that you have a disability, that this is an illness, is this direct cause. But what we know is that there are so many other factors that impact a person's health in causing disability, such as biological factors, psychological, sociological factors that can influence a person's disease or disorder. And that's what the biopsychosocial model is. And here's an overview of the biopsychosocial model, which is really foundational to health psychology because it's understanding the fact that there are so many different environmental factors that impact our health. For example, biological factors. Age, we know that a person of older age is more at risk for getting hypertension than a younger person. Gender and genes. Certain genes are more susceptible to certain diseases. And also the psychological piece in terms of our mental health, knowing that our emotions and our beliefs about our health impact how we feel. And also the social piece in terms of the interpersonal relationships. Adequate social support is healthier than inadequate social support. So how much social support a person has, and also where a person lives. What we know is that individuals who live in low-income areas, they may not have the resources needed to engage in healthy behaviors. So the biopsychosocial model is not just saying, okay, a person's sick, and so we need to treat that. And it takes into account other variables that impact that person not being healthy. So how does health psychology fit into all this? And when I say health psychology, you may have heard the term clinical health psychology. So those terms can be used interchangeably. And so we're talking about health psychology. Again, using the term clinical health psychology can be used as well. So we're talking about the examination of how biological, social, and psychological factors influence health and illness. And this definition is from the American Psychological Association. And so that's what health psychology is. And health psychologists, they use psychological science, such as interventions, to promote health and to prevent illness and to improve healthcare systems. So how the healthcare system is operating and addressing individuals' health. Why are health psychologists needed? Well, as you can see, there are many risky behaviors that can influence a person's health and that could lead to chronic conditions. For example, there's tobacco use, poor diet, physical inactivity, alcohol consumption. All of those can lead to chronic conditions such as high blood pressure, depression, and leading to early mortality. So health psychologists play a role in health promotion and decreasing the engagement of these unhealthy behaviors. And they play a role in disease management and providing psychoeducation about these behaviors, as well as prevention and behavior modification. So what is health promotion? And this is, it can be defined as a process of enabling people to increase control and to improve their health. So giving you control over your health, because the more control you understand and having the right tools you have over your health, the more likely you are to engage in healthy behaviors versus risky behaviors. So it comes down to a lot of times is understanding how those risky behaviors are impacting your health and what are some tools that I can be given to engage in healthier behaviors. And when we talk about risk behaviors, we're talking about consuming maybe high caloric foods, sedentary behaviors, smoking cigarettes, substance abuse. And when we talk about health behaviors, we're talking about ways, behaviors that are engagement to improve and maintain health. So what are those behaviors that when you engage in, that you are being healthy, improving your health, and not going in the direction of engaging behaviors that may lead to increased risk for early mortality or reduction of quality of life. So there have been found 7 health habits. And when I say habit, I mean something that is done without awareness. So it takes time, because engaging in health behavior may not come immediately, but it's something that takes time and practice. And 7 health habits that have been shown to improve health and reduce early mortality are meeting your sleep needs. And the recommended amount is 7 to 8 hours. But that may not be your sleep needs. So whatever your sleep needs, making sure that you're meeting your sleep needs. Not smoking, eating breakfast, limiting alcohol consumption, regular physical activity, portion control, and maintaining a healthy weight. So there are a couple of models. There are only 2 that I'm going to talk about today, but there are a lot of models that have been used to understand individuals' reason for engagement or not engagement in health behaviors, but ways that we can conceptualize and better treat and prevent illnesses. So the health belief model, it says that understand factors that promote engagement and preventive health services. So why does a person engage in preventive services and why don't they? So it highlights 5 concepts. How susceptible is a person to engage in a health behavior? And does that have to do with their perceived severity? So is that behavior considered something that is at risk for them? And if they go to the dentist, for example, what type of benefits will they have from, say, going to the dentist, engaging in preventive behaviors? And are there barriers? So, for example, a person who may be on dialysis, they know that, well, dialysis will, getting their kidney treatment will help them. However, there may be a barrier of transportation. So what are some concepts that impede on a person's ability to engage in preventative health services, or that that increases their chances to engage in them and leading to cues to action. And another model that I want to touch upon is the Transtheoretical Model. So changes in risky behavior, it's not something that happens all at once. It's a process that goes through stages, and how health psychologist goes about treatment depends on the stage that person is at. So for example, I'll use the example of quitting smoking. Pre-contemplation stage, that's the stage where a person may not have the intention of going about making any changes at that time. They may know that their behavior is risky, or they may not know, but at that time they are not interested in making any changes. And that's probably not the time to try to intervene in helping that person. Contemplation is where the person has thought about making changes in their behavior, and they are aware that there is a problem in their behavior, but hasn't made the decision to engage in a healthy behavior. So that's the stage where health psychologists may intervene at, because they are thinking about it and they may want more information, such as the pros and cons of the behavior, before fully making a commitment. So the preparation stage, that's where a person's really preparing to engage in changing their behavior. They may even wanting more information, and they may have been unsuccessful in the past. And so after the preparation stage, then there's the action stage, where the person is in the process of modifying their behavior. So for example, if a person wants to quit smoking, when they're in the action stage, they have made efforts to either cut back or completely eliminate cigarettes, and they're trying to achieve smoking cessation. And then you have the maintenance phase, where they have achieved eliminating that behavior, that unwanted, behavior that is causing or leading them to poor health. And so they're trying to maintain a healthy behavior. And this stage is usually 6 months or longer without relapse. Now, this process, it's not something that once a person goes through it once, they're done, but it's something that can be repeated several times. And when health psychologists meet with patients or clients, they are meeting them at one of these stages, and understanding which stage a person's at can better be informative in terms of how to go about treatment. So I want to talk a little bit just about a couple interventions. There are other interventions, but these are some of the common ones that are used in order to address unhealthy behaviors. So the therapist may seek ways to, in a variety of ways, to produce cognitive change modification in a person's thinking and belief system to bring about enduring emotional behavior change. That's cognitive behavioral therapy. And Beck, who is one of the leading scientists in this field, defines it as conceptualization or understanding of individual patient, such as their specific beliefs and patterns of behaviors. So how does a person's thoughts impact their behavior? How does a person's thoughts impact their beliefs? And how does the person's behavior impact their emotions? So it's this constant cycle of understanding that. For example, I'll use a smoking example, that a person may have the thought, I can never quit smoking. So because they have that thought, I can never quit smoking, well, they may not seek to engage in behaviors to help them quit smoking. And they may feel depressed or defeated because they don't have that thought of, oh, I can do it, but they keep having these thoughts that they're unable to do it. And so health psychologists work to address those maladaptive thoughts. And then there's motivational interviewing, which is another intervention. And this has to do with the collaborative conversation style for strengthening a person's own motivation and commitment to change. So when you're working with the individual, it's not you telling them what to do, but it's more of a conversation because they have the resources, they know what's impeding them, and it's working collaboratively with them in a way to help enhance motivation by resolving their ambivalence. So those are the types of models and interventions that may be used by health psychologists. And I want to talk about some of the settings. So where are health psychologists? Where are you going to find them? And they can be found in so many different settings. So this is a field you're interested in. You have a lot of opportunities. So you can be, so they can work in a medical setting along the side of physicians and nurses, so such as within a multidisciplinary team. So for example, if you're a health psychologist that works on a team treating cancer patients, then you may work along the side of oncologists or radiologists. If you are someone who works on a team who's treating individuals with diabetes, then you may work with, of course, physicians, but also endocrinologists. So there are different multidisciplinary teams in terms of how they look, but they all work together to address a person's behavior or address a person's condition. In the academic setting, you may find health psychologists can work in medical schools and in universities, and within the clinical setting, private practice, also in the workforce, helping to promote health behaviors among employees by working with employers on some of the programs that are implemented, such as stress management, smoking cessation, or a healthy lifestyle. So there are a lot of options in terms of the type of settings that a health psychologist can work in. So I want to talk a little bit now about conditions that that health psychologists may be involved in treating. There are a lot of different medical conditions, but some of the common ones, such as stress. So when I'm talking about stress, it's the appraising events as harmful, threatening, or challenging, and assessing one's capacity to respond to those events that are perceived to exceed one's resources are seen as stressful. So an event or something happening in the environment where the person doesn't feel that they have the resources to deal with. And when thinking about health, say a person is having to go for dialysis treatment every day, and they are having issues with transportation. Well, they're perceiving their current environment as not having the resources, so that may cause undue stress. And what we know about stress is that it can really impact us physiologically and decrease our immune functioning, can cause sleep disorders, anxiety, depression. So it's really important to for health psychologists to look at stress, particularly among individuals with chronic conditions, because it can actually exacerbate the condition. So one of the ways to assess stress is through self-reports, such as through questionnaires or even clinical interviews, to get more information from the person in terms of where they're at, and different types of treatment, cognitive and behavioral coping skills, relaxation techniques, and biofeedback, which I'll talk about in a moment. Another common condition is sleep. So we're all passive recipients of sleep. There's nothing that we can do to really bring sleep on if we're unable to sleep, and it is also something that we all need. And there are a lot of factors that may impact us from being able to sleep. And you know, it's an estimated that 70 million Americans suffer from chronic sleep problems. So there's a lot of, it's a high prevalence within our population. And some of these sleep problems are insomnia, sleep apnea, restless leg syndrome, and etc. And when we are unable to sleep or having sleep difficulties or suffering from a sleep condition, it can really bring about different health conditions such as diabetes, cardiovascular disease, obesity, or depression, and other conditions. But also these conditions can cause impairments in our sleep. And so health conditions can impact sleep, and sleep can impact health conditions. You can see where health psychologists are important in this role. And so there are different assessments that are done to help with sleep, a polysomnogram, and some of these are done within a sleep specialty clinic. but not within a clinical setting. Ones that are done, such as the assessments in a clinical setting, may be a sleep diary, a person keeping track of their wake time and the time that they go to bed, and also clinical interviews to get more information about the person. Sleep habits and types of treatment, cognitive behavioral therapy for insomnia, or cognitive behavioral therapy for sleep problems, medication, and integration of sleep hygiene. So looking at their sleep behaviors and ways to modify it. And the last one is weight management. So high prevalence of obesity among adult Americans, and then increased risk for chronic illness. Well, as we talked earlier about the biopsychosocial model, is we're not just looking at behaviors, but also genetic causes, environmental causes. And so that's when thinking about sleep or weight management or stress. Health psychologists, they take other variables and factors into account with these conditions, not just this one directional cause and effect. So with obesity, there are health conditions that can be exacerbated with the unhealthy weight. And so ways to screen to see where a person's at through weight circumference and BMI measurement. And while some of these have pros and cons, they're the best measurements that we have at this time to see where a person's at. And what some of the treatments are: behavioral lifestyle change, cognitive restructuring, and medication as well. So I talked about just some of the conditions that health psychologists may be involved in treating, and there are a lot more. And if you are interested in the field, you can either specialize in a certain area, or some are broad in terms of they are involved in helping individuals with various medical conditions. So here is just some other conditions and risk behaviors that could lead to clinical problems, such as tobacco dependence, or incorrect coping methods, like negative coping methods, could lead to possibly headaches or diabetes and chronic pain. So these are just some other clinical problems that health psychologists are involved with, and other health risk behaviors they are involved with in changing and helping an individual with. And so this brings me to the services that we offer here at NOVA. There are various clinics that are here to help treat different conditions. We have an anxiety treatment center. We also have a psychological service for emotional distress. And so there's different clinics that we have here that treat different conditions. And what we have, and so what I just discussed is that, a lot of conditions are interrelated and they're connected. So addressing some of these conditions can help improve a person's health in terms of their quality of life, and we're able to provide different services to do so. And so I'm just going to highlight some services that are related to health, the health psychology. One is our biofeedback. I was speaking about stress, and the biofeedback, it looks at this mind-body awareness and helping us understand what our body's going through, the physiological arousal when we are stressed. And they actually have equipment to show you what's happening with your body, and when you engage in relaxation techniques, what are some things that you're doing that you have control over that can impact relaxing your body. And then there's also the Healthy Lifestyle Guided Self-Change Program. And this program is actually one of the programs that I completed as part of my training here at Nova Southeastern University. And it's a great opportunity to learn more and have experience working with individuals who have behaviors that are related to health and their lifestyle. So it's a focus on motivational interviewing, and it's really geared towards motivate people to guide their own change. And so I had the opportunity to work with individuals who were struggling with substance use, and also individuals who wanted to improve and engage in more healthy lifestyle behaviors to achieve a healthy weight. And so not only those type of conditions, but there are other problem behaviors that this clinic works with in terms of quitting smoking and quitting gambling, and some are ones that actually lead to chronic conditions. So these behaviors can be addressed within this clinic using motivational interviewing. The other one is the Insomnia Program, and as we know, sleep can impact our health, and we have a Insomnia Program that looks at our behaviors and our thoughts in terms of how it's impacting our sleep. Usually individuals have completed a sleep study prior to entering the program, but that's not something that has to happen in terms of seeing a sleep specialist before you and seek help or enroll into the Insomnia Program. So you know, this is another opportunity. If you're interested in health psychology, you should know that these services are available, or if you're interested in taking advantage of these services, that there is a sleep clinic here at Nova Southeastern University. So how do you become a health psychologist? So I went over, you know, the different types of setting health psychologists are in, what are some activities that they engage in. So the academic outline training here is it's actually from the American Psychological Association. So in undergraduate, if you are interested, you want to pursue courses in health psychology, you want to find summer research opportunities that are related to health and that are medical focused, and you want to find maybe volunteer at a hospital or even in a private practice. So the bachelor's degree is like the foundation. And then there's graduate training. You can stop at a master's. If you stop at a master's, you can work as a research assistant or behavioral specialist. You can also work as a health educator. You will be working under a licensed psychologist, but you'll still be able to engage in different activities. And the doctorate, you can do a doctorate in philosophy or a doctorate in psychology. The doctorate in philosophy is more research focused, and the doctorate in psychology is clinical focused. And so you'll work independently if you do obtain your doctorate, and you're able to supervise research and supervise clinical teams. So depending on what your interests are and your career path is, this gives you an idea of the opportunities available to you as you pursue the field health psychology. And so here at Nova Southeastern University, I will speak, even though we have a PhD program, I will speak on the College of Psychology PsyD program in clinical psychology, because that's what I'm currently pursuing. And so within this program, you're going to get training and assessment, you can get research experience, also clinical experience as well. And as I mentioned, those different clinics, students work within those different clinics and get their training. So if you are interested in health psychology, you have the opportunity to get training either at a hospital, or you can get a clinical training here at Nova, and there are other options in terms of sites available to students within the program to receive training. And we have a great clinical health concentration so that you can specialize in health psychology and get more concentrated education within the field in terms of preparing you to manage, you know, severe illnesses or rehabilitation, disability, learning ways to prevent chronic illness or maintain good health. But I do want to say that you don't have to pursue the health concentration to be able to engage, to take advantage or to be involved in the coursework here at Nova. So if you are within the clinical program and you are interested in health psychology but not sure in terms of the clinical health concentration, you don't have to be in the concentration to take the health classes. And so there are a lot of different options to you into getting exposure to the field. So that's all for me. So I gave you an overview of what health psychology is in terms of the training that's available, what it takes to be a health psychologist. And so whether you are a prospective student interested in health psychology or you're interested in our services, do know that there are there's some contact information here at in the next slide. I'll go to that. That's available to you to reach out to find out more about the information that that you heard this evening. Thank you. So now I think we will open it up for questions.
Yes, Kristina. Raphael stated he loved your, thought you did a great job and you had an interesting field of study. So thank you, Raphael. Currently, we don't have any other questions. Kristina, would you briefly like to talk about your internship experience and how you're using health psychology in your internship?
Yes. First, I would like to thank you for that feedback, Raphael. So currently within the program, and I'll just go back to the program, you complete your training through being at Practicum Sites. So my first Practicum site was at the Guided Self-Change Clinic, which I explained earlier. And then now I'm currently at the Miami VA working with chronic pain patients and veterans. So now I'm in a hospital setting. So the first training I was able to get experience with different types of problems, and now it's more focused on chronic pain. And we do work with physicians, anesthesiologists, so that multidisciplinary team comes into play, definitely when you work in a hospital setting.